What are your scoliosis treatment options? There are two main approaches for scoliosis treatment, and this is for patients with scoliosis to really choose between. First is something that I call traditional surgical approaches, or to the traditional surgical or traditional scoliosis methods. And then I would like to call an opposite is something conservative or modern conservative non-surgical treatments. And both of them have very different goals when it comes to managing and treating a scoliosis. And knowing the difference between these two treatment options is very important, because really the path that you choose will typically end in the result that you are looking for, and also will affect your spinal health differently and potentially for the rest of your life. So this decision is a very important one to consider when you're considering your scoliosis treatment. Now, when we look at traditional treatment or traditional surgical treatment, there's two approaches in this traditional approach. And one we call is first they start off with a conservative approach, and then as the spine worsens, they move on to a surgical approach. And scoliosis surgery is a type of spinal fusion, so it's normally something that should be done as last results. So typically in this type of traditional surgical approach, for the first 25 degrees of a scoliosis, when the curve is considered mild, no treatment is typically recommended. And this is what they call conservative treatment. They're not doing anything, they're just monitoring it. And then once the curve breaks 25 degrees, but less than 45 degrees, now they're calling it a moderate scoliosis, and the only patient that's actually treated at this time is going to be an adolescent that is growing. If they're actively growing, they'll put them in a Boston brace or a Providence brace, and they're just trying to slow down the worsening to try to prevent surgery. They're not trying to make it better, not trying to reduce the size of the curve. They're not expecting that. If the patient is not actively going through puberty or actively growing, meaning they're an adult, no treatment's prescribed. They're just said, okay, let's see what happens and watch it and see if it worsens. And then if it breaks 45 degrees, now they call the scoliosis severe enough to consider surgery, and this is where they start considering spinal fusion. And this involves fusing the unnatural spinal curvatures at the most tilted vertebra on top to the most tilted vertebra on the bottom. And this can sometimes involve 10, 11, 12, 13 vertebra. And they use metal rods and screws, and they try to hold the spine in place while they use bone grafts in between the vertebra to actually fuse the spine together. And the goal is to stop the curve from progressing. That's the number one goal, but they also tend to reduce the size of the curve during this scoliosis fusion. The problem is they can make the spine straighter, but they do it at a tremendous expense. They're reducing spinal function. They remove movement and flexibility of the spine. They make the spine have more problems. And we know a fused spine potentially could be weaker, could be more vulnerable to injury. Patients can experience a lot more functional deficits. They're definitely going to lose spinal flexibility and range of motion, and potentially have more pain. So this is a serious thing to consider when we look at when the curves are less than this, there's not a lot of things performed. Now, when we look at a real conservative non-surgical treatment, or more of a modern conservative non-surgical treatment, these non-surgical treatments are normally treating scoliosis much more proactively. And the goal is to treat curves as close to the time of diagnosis as possible, whether the person is actively growing or not, and whether the curve is 20 degrees or 30 degrees, or even 60 degrees. The goal is to try to reduce the curve as much as possible. And the goal is by reducing the curve, we reduce or prevent progression, and this reduces the effect or increasing effect of scoliosis. And if we can reduce the increasing effect, increasing risk of progression, we can reduce the need for surgical treatment. So our approach is that we treat curves as small as possible to make them as small as we can, where a surgical approach says, well, why treat it when it's small? Because we don't know if it's ever going to become surgical. And my point is that's the whole reason why we want to treat it, so it never becomes surgical. Typically, modern conservative treatments are integrative, meaning they're not just watching and then maybe putting a Boston brace on, and then if it worsens, they do scoliosis surgery. It's normally combining many scoliosis treatments. Multiple scoliosis-specific treatments are normally combined to impact the scoliosis on many different levels, structurally, functionally, strength-wise, flexibility, and posture. So typically it's combining chiropractic care, physical therapy, scoliosis exercises, corrective bracing, scoliosis rehabilitation. All these are customized for the person based upon their curve type, age, curve, likelihood of progression, and size. And this customized treatment plan has the goal as not only trying to slow the curve down, but really to try to remove some of the curve size to improve function so the body can now move and function better, not just fuse it and limit function. Now, how do we know which treatment option is best for any patient? Well, once you understand that most patients need to be aware that both treatment options are available to you almost at any time during your scoliosis treatment journey. We can consider conservative treatment in small curves and moderate curves or even severe curves. Scoliosis surgery typically is only normally recommended when curves already become severe. So we normally, patients that I treat conservatively, want to try to avoid scoliosis surgery or already been told they need scoliosis surgery. We're trying to take them out of that realm. So therefore, traditional treatment options is definitely the most dominant choice for many years. But what we're noticing now is many patients are not wanting to experience scoliosis surgery and they're searching for other treatment options. So this traditional treatment tends to funnel patients more towards spinal surgery. And since more patients are becoming aware of this, they are now searching for a more proactive, more preventive type of scoliosis treatment other than just reacting with scoliosis surgery. So therefore, patients need to understand that if you go down the traditional approach that's normally monitored by a scoliosis surgeon, if the curve becomes severe enough, eventually you're going to be recommended scoliosis surgery. Where if you're being treated with a doctor that the goal is to try to prevent scoliosis surgery and reduce it, the goal is aggressively trying to reduce the curve as much as possible to preserve function and health, and this can improve your overall quality of life. In many cases, scoliosis does not require surgery, particularly with early detection and early intervention. Now, my average patient I treat, unfortunately, is surgical level because they did exactly what I mentioned in the traditional approach, and they end up getting told they need surgery, and then normally that's when I get a phone call. But however, about 30% of my patients I treat pre-surgical levels, and these patients respond way better than my surgical level patients, meaning they get much greater reductions and much stronger reductions. So what it tells me is that if patients just treat their curve early, the likelihood of them needing scoliosis will decrease. Scoliosis surgery will decrease tremendously if we just can treat a curve early. And we know scoliosis is a progressive condition. It's its nature to worsen over time. So early detection is very important, but early detection is only valuable if we also treat early. So treating a scoliosis while it's still mild, goals are much easier to achieve. Nothing definitely guarantees scoliosis treatment success, but the smaller the curve, the simpler it's to treat, the younger the patient, the better the results, and the less severe it is, meaning there's less difficult to reduce the curve. So the main benefit of early detection is those who actually proactively treat their scoliosis immediately following diagnosis before significant progression has occurred. Progression makes the spine definitely more rigid, it makes it less responsive, and can potentially lead to more severe effects such as postural changes and muscular balance. So early intervention means starting treatment when the condition is at its mildest. However, traditional scoliosis treatments tend to do nothing when scoliosis is mild and only wait to treat the scoliosis when it becomes more severe. And this is the main difference between a modern conservative treatment and traditional treatments. One is more reactive, where one's more proactive. So therefore, the best scoliosis treatment option is one that's aligned with your desired outcome. If you're looking for more of a surgical approach and looking to put rods and screws in your spine and manage your scoliosis surgically over your lifetime, then consider a more traditional approach. If you're trying to avoid scoliosis surgery, prevent rods and screws in your spine, and you don't want to go through that invasive surgery, consider more a modern conservative approach that's trying to treat your curve more proactively and preserve function. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.